morning. So here we are with our patient, and we're going to ask her what really bothers her, and we're going to address what really is bothering her today. So, Tara, can you tell me what bothers you?
Yes, Dr. Nagrani, I'm beginning to see the dropping right here in my jowls and around my mouth, and just, well, I'm beginning to show my age a little bit there.
I know. So this is what most of my patients complain about, is that little area. Sometimes these lines, the nasolabials, which bother them. And so here's what I would suggest for her is, these are your symptoms, but this is your problem, okay? What we need to do is we need to pull the skin up a little bit, and that's where threads come in a picture, because the filler has really done a good job of taking care of the midface, and we can add a little volume to her. But what we're going to do today is do some threads, the PDO threads, which are absorbable suture. We're going to go right underneath and pull this skin up a little bit, where she can see a nice softening on this area which bothers her. And I like to use combinational threads, and we're going to use the PDO threads. PDO threads have been used in surgeries for years. They're absorbable sutures, and they just get absorbed, and they stimulate the collagen and tighten that skin, and we can all use that little lift, okay? So right now I have numbed her up in this area, and you can see I'm gonna go with a little bit of needle. Tara, do you feel a little bit numb there? Okay. I have already marked her, and if you feel anything, just let me know. I'm going really just a little sub-Q, and so it should not be painful, but sometimes you do have that little spot. Okay. This is what the thread looks like. It is spiraled around, and it has two ends. They're bidirectional threads, and it's very amazing how they work. And what I'm going to do is I'm going to have you turn your face just a little bit. I'm going to slide it gently under her skin. And I'm feeling that thread, so I know as I'm going where I am and in which plane I am. I rotate. You can feel the tip of the end there. Are you feeling anything, Tara? Are you comfortable?
I'm comfortable.
And I'm going to pull this out. And you can see that it's really pulled that area which she was complaining about. And there, you bury the end. And I'm going to do a couple more threads just like that, and cross hatch it with some smaller threads. And when we have her set up, you'll be able to see that difference. Tara, are you doing good? Looking right at the area which bothers her. And you can see how it's pulled her jawline really nicely. There's really no major complication from threads as we are doing it. The only thing sometimes is like you might say, oh, I really liked it and I need some more, because the sutures do get absorbed, and you might just want to add some more, But other than that, it really gives you a nice lift. These are some of the smaller ones. They go a little bit more superficial. I think Tara felt that one a little bit. And like I said, I'm gonna again cross hatch it here for her. these ones really do a good job at improving the skin as well. But like you can see, I'm going to use some pink ones along the jawline. Threads can be done in any area, you know, which needs a little lift. It is not your facelift, but I do see a lot of patients who don't want to have the downtime, don't want to get the facelift done, or are just looking for that subtle change and natural looking results with no downtime. And you can do the threads and it will show you that difference. You can have a little bit of swelling and bruising in that area just for a day or two, but nothing you cannot cover it up with the makeup. Do you feel a little tighter, Tara?
Mm-hmm.
Yeah, you do feel that tightness, and usually you want to make sure you're not doing any major activities for those 2-3 days. But other than that, I'm gonna have Tara set up, and you can see how it looks different from both the sides. And that's what I'm gonna show to Tara between her two sides, and it really see if she notices it.
Oh yeah, for sure.
What do you think?
Oh, I'm excited.
Isn't it?
It just makes you want more. It's great. It looks awesome, Dr.
Looks
Nana.
good. Okay. Thank you. And I know, you know, this is a spot which is a little swollen, but it will settle down. And these are not her final results. Threads do continue to improve as they're stimulating collagen. They're going to continue to get better. We're going to do her other side. And we'll post those before and after pictures from 2 weeks from now too. Thank you again for following us. If you think threads are something you would want to know more about, give us a call at 281-298-5476. Thank you.